Hello everyone, thank you for coming. My name is Meagan Gardener. I'm the State Director with Organizing for America here in West Virginia. We are here today as part of the National Healthcare Week of Action because Americans know that the status quo of healthcare is no longer acceptable. We are here today because the skyrocketing costs of healthcare are crippling American families, and we all know that this is unsustainable. 13.8% of West Virginians do not have health care, and even more have inadequate coverage. Volunteers with Organizing for America have been working tirelessly, calling their neighbors, going door to door in their neighborhoods, and talking to people about health care reform and why it is so necessary to have reform happen this year. President Obama has laid out 3 basic principles of health care reform, which are to reduce costs for families and businesses, to guarantee choice of doctors, hospitals, and health plans, and to ensure quality, affordable health care for all Americans.
My name is Teri McGee, and I'm a registered independent. I am a wife, I am a mother, and I serve in the ministry field, and I do volunteer work. My husband of 22 years works full-time at a job that pays $10 an hour, and to support our family of 4. Our oldest daughter is 16 and our youngest is 11. My husband is our only source of income at this time. His job offers insurance, yet we cannot afford it. It is insurance that doesn't even cover enough to make it worth it, and we would have to choose either the insurance or essentials like food, clothing, and gas. I have no thyroid. I had to have it removed 11 years ago, and I cannot afford the doctors and the lab costs to have my blood work done. So I am without my life-sustaining medication at this time. We have had to make some tough choices. The insurance companies don't cover pre-existing conditions, so even if we did go without the basic necessities, I wouldn't be covered. Because of my complex case and my pre-existing conditions, the free clinic, which isn't free by the way, cannot see me because they do not have the doctors or the lab capabilities to check my blood work there. And then there is the cost of prescriptions. This is just a part of our story. I'd like to think our family is unique. I know we're not. We have friends and family that are even worse off than we are. All working, all upstanding, contributing members of society. Welcome to the middle class working members of this country. This is the same country that my husband fought for and served in both Iraq wars, and would again if he was asked. So don't paint us as anti-American or unpatriotic.
I've experienced over the years, not only in my community, but in my family, people that cannot get insurance, cannot get medical care. And in the results, then I see those patients in the hospital when it's really too late. Their disease has progressed, they cannot get their medicines, and so therefore they are at the most highest cost of medical care. This leads into bankruptcy, or this leads into people just not getting the care. I like to speak for them there. I also have family members that work 2 jobs that can't afford medical care. This isn't right for America. We have talked about this since before the Clinton administration, and everybody decided that this isn't America. That it's not a right or a privilege to have insurance, but it is a right of everyone to be covered in some fashion, in some way. This is a bill that will help do that. If you have insurance, you can keep your insurance. You can keep your high deductibles. You can keep the cost. But for those of us that can't do that, then there should be an alternative. And this is what this plan does.
We have a marvelous opportunity to rectify a problem that has been created over a 40-year period. We're as close now as we ever have been. A lot of people are now getting spooked because they're saying it's going to cost $1 trillion. Well, let me point out to you that there are some economists that say that if we do nothing, if we do not act, then it's going to cost us over the next decade $33 trillion. So I got to tell you, the $1 trillion is looking like a pretty good bargain to me. And my sense is that we can do this if Congress stops getting spooked. It's something that the American people said was a mandate for everybody in public office this year. When we changed the Congress, when we elected Barack Obama as our president, the mandate was for change. One of the biggest drains on our economy right now, our economy which is a suffering economy, is health care. The cost of health care has risen by 400% just over the last 20 years. And if we continue to do nothing, if we continue to not address this, it will go up again and continue to go up again.
Now, social workers work with people to alleviate psychosocial problems that keep people from healing and reaching their potential. That's what we do in our field. And I spent about 10 years in the healthcare field, mental health, community health, hospitals, and nursing homes. And the people that I saw, I had to do things for them that I didn't expect, because I thought, you know, most people had health insurance coverage and they would be taken care of, their bills would be taken care of. But we had a 19-year-old gentleman, a young man who came in with a bad heart, didn't even know it, ended up in the ICU. He had no insurance coverage. And before I knew it, I was on the horn to the media like you, trying to get some public sympathy for this guy so people might pour out their hearts and help him get a heart transplant. That young man died before he could get that transplant. If you walk into a 7-Eleven or a grocery store or a community convenience store, you are likely to see a very heart-wrenching picture of a young boy or a young girl or a member of the community sitting there on a coffee can asking for your support and donations. Now, this country is better than that. These are people who wouldn't have been in this condition very likely if they had had reliable health coverage early on, from birth all the way through the life cycle. This is what we're talking about right now. If we can expand coverage to folks, however we do it, then we will begin to realize the savings that come down the road. It's been estimated we could save, for example, $100 billion just by attending well to people's psychosocial problems that complicate their health issues. And there are many, many examples of that that go on and on across the spectrum. We have sticker shock right now. I can see it in your eyes, I think, in the audience here. That doesn't need to be in the long term. Right now, it's going to cost some money. Later on, when we are all covered, we will begin to realize the savings. We will also have lifted from us the mantle of fear and distress that comes from not knowing whether or not you can afford health insurance, whether or not the insurance that you have is actually going to cover you, and what in the world you would do if you have no coverage and have these high medical expenses come toward you.
But not only is there an economic imperative, there's a moral imperative. We heard the story. I don't know if anybody in this room has ever been without health insurance, but it has multiple consequences, not the least of which is death. And the Institute of Medicine reported within the last 2 years that their estimates are that every year in this country, nearly 20,000 people die simply because they don't have health insurance. Now, if that's not a moral imperative, what is? Yes, we can complain about, well, this may cost too much, or this may affect this aspect of my business. But when people are dying, we have to look past whatever our concerns are in terms of the normal political aspects of an initiative.
We at Organizing for America are working very hard to talk to people about health care, and I think that these stories and these people behind me today have illustrated how important it is and why we need health care reform this year. So thank you everyone for coming.